Good morning, everyone, and happy Wednesday to you. Thank you so much for joining us in a conversation about the transformation of mental health through social work. For those of you who are tuning in for the first time, my name is Karen Dubin. I am a social worker. I have my PhD in social work and an LCSW, and I am the Chief Operating Officer and one of the main facilitators for Sweet Institute. And I also have a private practice on the side where I work with individuals, and I also do some coaching and some supervision of clinicians. We are continuing the conversation of the transformation of mental health through social work. And we had, this is an opportunity for us to come together in this conversation as fellow social workers, seeing what's there for each one of us as we take on this role and as we choose to see where it is we want to be in the transformation of mental health. And last week, I had an opportunity to just share some reflections and some hesitations for myself in that process. And interestingly enough, we had an opportunity to meet with a number of social workers over the last week and get a sense from them about what transformation of mental health, means to them, what role that they think that they can play in this process. We have a survey that's out that I'm going to put the link in the chat box below so that you can take the survey as well. And if you want the opportunity to have a conversation with us about what you think in terms of the transformation of mental health and what your role is in that process, please feel free to reach out to us at contact@sweetinstitute.com. We'll set up a Zoom call with you so that we could get your ideas, your thoughts, your perspectives of this whole thing as well. So when we met with social workers over the last week, one of the themes that began to emerge was about our identity and how, and so these ideas of both the personal and the professional, the distinctions between who I am as a social worker professionally and who I am as a human being that also is about who I am as a social worker. And on top of that, the personal is professional and the professional is personal kind of conversation. There was also a conversation about the roots of social work and what the roots of social work is about. Community engagement and being where people are, and literally being where they are, and whether or not in the evolution of social work, we've collectively, not necessarily individually, but collectively taken a bit of a step back from that, those original roots of social work practice. But it created a really dynamic conversation about in the idea of being a change maker and whatever that means to each one of us as social workers individually, what is that role for us? What does it mean to be a change maker? What does it mean to be a social worker? What does it mean to choose or not to be a part of a movement when we know as social workers that there are so many barriers for our clients to be able to receive the level of care and support that they are truly entitled to. And so again, it made me reflect on my own career, how things began for me in community mental health, how they evolved into private practice, and also my role in being able to contribute to clinicians nationally. And also this, ongoing, process of keeping my boots on the ground. So I'm connected to the different communities I've had an opportunity to serve. And with that, still this identity around taking on being a change maker on a grand scheme around a movement of what it means to be a social worker and what it means to transform mental health. And so I invite you into that kind of conversation. I invite you to take a look and see what might be present for you in terms of where you might be as it relates to a role you want to take in transforming mental health. And I know for me, as an example, when I first began considering this part of the conversation last week and what I had an opportunity to reflect on even more, when I first began thinking about this, part of what was coming up for me was this idea that it was something I was doing alone. Even though I'm surrounded by social workers all the time, even though this is my community, there was this experience of hesitation, and it was related to like being alone in the process and it being solitary and feeling the burden and the weight of that just on myself. And really, when I took a look and I had an opportunity to engage with all these fantastic people over the last week, it really occurred to me that that was just my own thinking, and that we are a community of over 700,000. And so there's no aloneness for us. So I'd love to hear your thoughts. Please join me in the conversation. Click below, take the survey, and join us on Friday. We are starting our Social Work Power Certificate course. You could come to one session, you could come to all the sessions. It's completely up to you, but we would love to see you there and have you be part of this conversation with us. So have a wonderful rest of your day, and I look forward to being back with you on Monday.